would go out from the mother. So after washing the baby, they are given a prophylactic gentamicin dose, both eyes. Why? This is to avoid ophthalmia neonatorum. Okay? So before, it was actually with silver nitrate. However, due to the deposit of silver in the cornea, this is not anymore being used in the hospital. So hindi na yan siya ano. Kasi merong ibang mga like nabasa ko na reviewer ninyo na old na yun masyado ang question. Ang sagot doon silver nitrate pa rin. Nowadays, hindi na natin ginagamit yan sa mata. Okay? Due to the deposit of silver in the cornea. So, that's why gentamicin na. Okay, did you get it? So, levofloxacin, no, for your conjunctivitis, and higher concentration is for corneal ulcers. And then moxifloxacin for your conjunctivitis, and then afloxacin. Tabromycin is just external infection, no, of the eye, especially the common conjunctivitis like changes in the humidity, tapos nagkaroon ng conjunctivitis. Yung mga common na mga ano ngayon. Okay? So these are the other antibacterials that are actually available for ophthalmic use. We have penicillins, cephalosporins, sulfonamides. The problem lang with sulfonamides, sometimes it can cause kasi increase in the pressure of the eye. So kaya kung meron pang ibang alternative, no, hindi ginagamit halos ang sulfonamides, including the hypersensitivity reaction of the patient. So tetracyclines for as long as the patient is not pregnant. Okay? So chloramphenicol and then aminoglycosides, and for as long as the patient is not on dialysis. So pwede lang aminoglycosides. Fluoroquinolones and then vancomycin, especially with cases of MRSA or methicillin-resistant Staphylococcus aureus infection. So vancomycin yun. Okay? So macrolides. And other antibiotics na used topically in prophylaxis, pre or post-operatively, and the treatment of ocular bacterial infection. When we say prophylaxis, that is for prevention of, meaning to say prevent natin, no, para hindi magkaroon ng infection. So kumbaga, kung naoperahan yan siya, ayaw natin na magkaroon yan siya ng infection. Secondary to the unclean na mga practices. Kasi all ocular surgical procedures are actually clean. So, bakit pa natin kailangan ng antibiotic? Again, for prophylaxis. So, used orally for the treatment of preseptal cellulitis, just like this one. This is preseptal cellulitis. So, mahirapan ka na yan magbuka. Sige daw, buksan mo yung mata kung kaya mo yan siyang mabuksan na masakit yan masyado. So, kaya, kadalasan, binibigay yan siya orally. So, if it is for children, oftentimes it is with co-amoxiclav. Co-amoxiclav is amoxicillin plus clavulanic acid. That's why it is called co-amoxiclav, because it is in combination. So, and sometimes with cefaclor, other like second and third generation of cephalosporins. Used intravenously for the treatment of orbital cellulitis, we have gentamicin, cephalosporin, and vancomycin. So can be injected intravitreally for the treatment of endophthalmitis. So specific antibiotic for almost each organisms, like for example, sulfonamides, no, for chlamydial infections like trachoma, inclusion conjunctivitis, or toxoplasmosis, lalo na pag may alaga kang pusa, o di ba? Oftentimes, ang mga pusa natin, lalo na yung gumagala, hayaan lang natin na gumagala-gala sa labas, tapos hindi pa talaga pinapaliguan, no? Kadalasan, It's in either bubonic plague or the toxoplasmosis. Bacterial cell wall synthesis inhibitors, we have penicillins, no, cephalosporins, and cephalosporins before is actually up to only fourth generation. So, ang ano nga, sa ngayon, meron na tayong fifth generation of cephalosporins. So what are the side effects? Allergic reactions. So we need to describe what kind of allergic reaction it would be. So neutropenia, thrombocytopenia can also be expected. Aminoglycosides, mainly against gram-negative bacilli, bacterial protein synthesis inhibitors, oftentimes in 0.3% concentration only. So hindi naman yung ang problema lang natin dito would be on the usage of preservative para hindi ka agad masira. And the preservatives mostly can react to the secretion of the eye. So tetracycline, this inhibit protein synthesis and active against both gram-positive and gram-negative, and including some fungi and chlamydia. So chloramphenicol has a broad spectrum bacteriostatic, gram-positive or negative chlamydial spread. So 0.5% eye drops or ointment. So how about fluoroquinolones? Most frequently used topical broad-spectrum antibiotics, and ciprofloxacin, like 0.3% of eye drops, afloxacin, moxifloxacin, levofloxacin, desifloxacin, eye drops. So those are the different eye drops. So what are the different eye conditions? So number one, we have trachoma, can be treated by topical and systemic tetracycline or erythromycin and systemic azithromycin. And the bacterial keratitis, So this is an example of bacterial keratitis. So bacterial corneal ulcers can be treated by topical fortified cephalosporins, aminoglycosides, vancomycin, and fluoroquinolones. So bacterial conjunctivitis is usually self-limited by topical erythromycin and aminoglycosides, including fluoroquinolones or chloramphenicol to be used. So this is an example of dacryocystitis. So this is an infection of the lacrimal sac, and you need to probe that. So probing is so that why you need probing on this? Para magkaroon ng opening para mag-drain ang laman ng sac. So this is a herdiolum or sty. So this is an infection of the meibomian gland, Zis and mole gland. So this is a type of conjunctivitis, inflammatory process of the conjunctiva. And then the blepharitis, the bilateral inflammatory process of the eyelid. Ayan. It is oftentimes at the margin of the eyelid. So these are the different antiviral agents for ophthalmic use. We have trifluridine and then acyclovir, especially for herpes zoster. So most often than not, kasi kadalasan pag sinasabi nating immune na tayo ng chickenpox kasi naka-chickenpox na before, hindi siya like 100% na safe for other patients exposed to chickenpox already because you might be developing shingles. So that's reinfection, and it is quite more painful. Why? Because it follows the dermatomal distribution of the body. So kung in short, kung saan dumadaan ang pain stimulus. So yun ang titirahin niya. So masakit. So kung sa mata, parang iluluwa ang iyong mata. So that is what you call herpes zoster ophthalmicus or herpes simplex iridocyclitis if it affects the iris. And the valacyclovir for the herpes simplex keratitis. And if the patient is not respond or does not respond to the cyclovir given. Famciclovir also can be used for herpes simplex keratitis. So foscarnet, especially for patients with HIV, because they had contracted the cytomegalovirus, no, or the cytomegalovirus retinitis. So inflammation of the retina secondary to cytomegalovirus. Oftentimes, the cytomegalovirus would just affect those with low immune system. So, di ba, compromise man ang immune system ng mga patients with HIV. So, kaya kadalasan ito yung nakukuha nila. Kaya lang, if it would not respond to foscarnet, then cidofovir is given intralesionally. So, meaning to say, sa lesion mismo, itusok. So, other antivirals, for example, acyclovir, this is the most commonly used antiviral, like 3% ointment, 5 times, like 10 to 14 days, no? And then 800 milligram orally given, 5 times, 10 to 14 days also. Intravenous for herpes zoster retinitis, especially if the herpes zoster or the shingles affects the retina. Okay? So this is an example of a viral dendritic ulcer. Ayan. So if you try to take a look at the, what they call this, at the dye, o diba, it would what? Make the delineation of your tearing, diba, in the cornea more pronounced. Klaro mo siya. So that is an ulcer, meaning to say merong sira sa contour. This is an example of CMV retinitis. Okay? So almost it looks like a cotton wool spots. And then you have the hemorrhagic portion. Okay? So that is the ophthalmoscopic, picture of those diseases. How about the antifungals? Because mostly, ang antifungals kasi it would have what? A lot of roots. So umaangkla siya doon sa iyong tissue itself. So one example is your amphotericin, natamycin, fluconazole, etraconazole, ketoconazole, and meconazole. So these are the different agents being used as an antifungal for the for ophthalmic uses. So the indications, fungal corneal ulcer, this is for fungal retinitis or endophthalmitis, and commonly used drugs are polyeins, damage cell membrane of susceptible fungi, or example, amphotericin B, natamycin, nystatin. Side effects would be nephrotoxicity. So we have imidazoles. This increase fungal cell membrane permeability. Example are your what? Meconazole, ketoconazole, fluconazole, and then you have your flucytosine. So these act by inhibiting DNA synthesis. So these are the different examples, with regards to the penetration in the cornea. Okay? So, mydriatics and cycloplegics. Tulad nito, di ba? Masyado ng related. And then, because this is the one that is being used to dilate pupils or somehow in ciliary muscle paralysis para at least bumuka naman yung kanyang pupil. So, short acting, we have tropicamide. Intermediate acting, we have humatropine. And long acting, we have atropine. So, these are the different mydriatics and cycloplegics that is present in the market. And then, Where can we use this? So for the corneal ulcer, uveitis, hemiplegic refraction. Okay, so these are the different examples of the drugs with different formulation and then the indication for use, including the ocular side effects. Okay, take note of each and every drug, including its concentration. Okay, do you have any question? Question? Wala? So I hope you would study your lesson. We will continue our discussion next topic. Next meeting, I mean, the next topic will be discussed next meeting. But before that, let me check the attendance first.